How to spot eating disorders in men. Anyone can have an eating disorder, whether you are male or female. However, men are less likely to have an eating disorder as well as to seek help for it. If you suspect that you or a man you know may have an eating disorder, then there are some things you can consider to confirm your suspicions. If you still think this is the case, then it is important to encourage this man to seek help or to seek help for yourself. Method 1: Watching for signs of an eating disorder in men. 1. Identify unhealthy eating patterns. The first thing that might indicate that someone has an eating disorder is the way that they eat. This includes the types of foods they will and will not eat, the amount of food that they eat, and how they eat their food. Pay attention to the person's eating behaviors to determine if he may have an eating disorder. For example, a man with anorexia may only eat low-calorie foods such as lettuce, celery, and carrots. He may also limit his food intake by eating extremely small servings, or by staying within a rigid calorie limit, such as 800 calories per day. You might also notice that he avoids eating around people. Someone who is bulimic might exhibit unhealthy eating patterns by eating large amounts of food, but never seeming to gain weight. However, people with bulimia are more likely to binge in secret than in front of other people, so you might never see this behavior. Pay attention to whether or not he goes to the bathroom immediately after eating. Watch for excessive overeating in men with binge-eating disorder. Men who have binge-eating disorder may eat to excess on a regular basis. They may eat this way even if they are not hungry. 2. Look for significant weight loss. If you notice that a man has recently lost a significant amount of weight in a short space of time, then this can also indicate a problem. Watch for a significant drop in weight as a sign of an eating disorder. For example, if a man who is a healthy weight drops 20 pounds in 1 month, then this would be cause for concern. Pay attention to signs of weight loss, such as looser fitting clothing, a more pronounced bone structure, or claims of significant weight loss. 3. Listen for a preoccupation with being thin. Someone who has an eating disorder desires to be thin so much that it will dominate his life. You might notice that the person talks constantly about dieting, calories, food, exercise, and other weight loss topics. This is common in people with eating disorders. Reflect on how often the person talks about weight loss, nutrition, and exercise. Do the person's comments seem healthy or obsessive? How much of his time do these topics seem to occupy? For example, you might have a friend who tells you about a new diet or exercise program he learned about every time you see him. He might talk about nothing but dieting and exercise when you are together. 4. Note a preoccupation with body image. People who have eating disorders are overly focused on their bodies and they often have distorted perceptions of themselves. Therefore, someone with an eating disorder may look at himself in the mirror constantly, criticize his body, and compare himself to others. Pay attention to how often this man talks about or seems focused on his body. Does this preoccupation interfere with his life or relationships? Has he stopped engaging in other interests because of his preoccupation with his body? If so, then he may have an eating disorder. 5. Watch for excessive exercising. Men with eating disorders are more likely than women with eating disorders to engage in excessive exercise behaviors. This may include exercising to excess to offset calories after eating, or spending hours at the gym on a daily basis. Consider how much time he devotes to exercise. If he is devoting an unreasonable amount of time to exercise every day, then this can be a good indication that he may have an eating disorder. 6. Identify the use of illegal or prescription drugs. It is common for people with eating disorders to use illicit or prescription drugs to help reduce appetite and increase metabolism. For example, he might use cocaine, amphetamines, or diet pills to help reduce his appetite and speed up his metabolism. Consider any drug use that you have noticed in the person. Method 2. Identifying risk factors. 1. Reflect on the person's family history. People with eating disorder may come from families where eating disorders are common or where other types of mental illness are prevalent. Think about whether or not other family members have dealt with eating disorders or other mental health issues. For example, if he has a parent or sibling who had an eating disorder, then he is at a higher risk of developing one himself. Likewise, having a parent or sibling who suffered from depression or an anxiety disorder may also put him at a higher risk of developing an eating disorder. 2. Note any psychological factors. People who have eating disorders often have other mental health issues that put them at a higher risk of developing an eating disorder. Consider whether this man has dealt with any mental health issues himself. For example, a man who has an anxiety disorder or depression may be more likely to develop an eating disorder. High stress levels can increase a man's risk of developing an eating disorder as well. Pay attention to stressors such as a difficult job, financial troubles, and relationship issues. A history of abuse or alcoholism can also increase the risk of developing an eating disorder in some men, so consider these factors as well. 3. Watch for eating disorder symptoms in professional athletes. Professional athletes have a higher incidence of eating disorders, especially those who participate in sports that require lots of jumping. For example, someone who is a pole vaulter may be more likely to develop an eating disorder. Ballet dancers, models, and actors are also more prone to eating disorders because of the pressure to stay thin for the job. If he is involved in a sport, then consider whether this may be putting pressure on him and increasing his desire to be thin. 4. Be aware that sexual orientation does not matter. Anyone can develop an eating disorder whether they are gay or straight, male or female. Among men with eating disorders, about half are gay and half are straight. However, there is some evidence that gay men may be at a higher risk of developing an eating disorder due to peer pressure and media influence. Do not use sexual orientation as evidence that a man may have an eating disorder, but recognize that there may be a higher risk for a man to develop an eating disorder if he is gay. Method 3. Determining the type of eating disorder. 1. Identify signs of anorexia. Anorexia causes people to restrict food to an unhealthy level and to try to lose as much weight as possible. You might notice that someone with anorexia is underweight yet is still trying to lose more weight. Some other symptoms to watch for include having a BMI that is less than 18.5, having an intense fear of weight gain, incessantly reducing caloric intake, such as an intake of 300,500 kilocalories per day, engaging in compulsive physical activity, refusing to maintain a healthy weight, denying that he is underweight, binging and purging by self-induced vomiting and laxative abuse, relying on weight loss and food restriction for self-esteem, being suicidal, withdrawing from social interaction and failure to fulfill academic or career potential. 2. Look for signs of bulimia. Bulimia is characterized by a pattern of binge, eating, and purging. People who are bulimic will eat a large amount of food and then purge it using laxatives, vomiting, or by engaging in excessive exercise. Unlike people with anorexia, people with bulimia may be at a normal weight or even a little overweight. Some symptoms to watch for include BMI in the normal or overweight range between 18.5 and 30. basing sense of self, worth on body weight and shape. A persistent sore throat. Swollen cheeks, caused by swollen glands in the neck. Weakened tooth enamel. Acid reflux. Dehydration and/or electrolyte imbalance. Upset stomach from laxative use. Having a significantly elevated risk for mortality due to complications of the disorder and suicidal tendencies. Reducing social, life activities. 3. Watch for signs of binge-eating disorder. Binge-eating disorder is a common problem in the United States. This eating disorder is characterized by eating large amounts of food in one sitting. However, people who have binge-eating disorder do not purge like people with bulimia do, so they are usually overweight or obese. Some things to watch for with binge-eating disorder include eating large amounts of food quickly. Eating more than a reasonable amount of food in one sitting, such as an entire large pizza or a large bag of chips. Eating an amount that makes the person feel uncomfortably full or even sick. Sneaking food and eating in secret. Trying to diet but often losing no weight. Feeling stressed, guilty, or ashamed about binges. 4. Encourage the person to seek help. If you suspect that a man you know has an eating disorder, encourage him to seek help. Encourage the person to speak with a doctor. He may be referred to a mental health professional, such as a therapist. Registered dietitians also have a central role in any successful treatment program for eating disorders. Try saying something like, "I have noticed some things about your eating habits and preoccupation with your weight that are making me concerned. I care about you and I want to help. Would you consider talking to a doctor about this?" There are also patient rehabilitation centers that deal specifically with eating disorders. You may consider helping the person find more information on these treatment centers. If you think that you may have an eating disorder, then seek help for yourself. Talk with a trusted friend or family member about the problem and ask for help getting treatment. You may also call your family doctor and set up an appointment to discuss what has been going on.